The prevalence of narcissistic personality disorder. How common is NPD? From the editorial staff of understandnarcissism.com. Exploring the real prevalence of narcissistic personality disorder and why does it often seem more widespread? With so much focus on narcissism in recent years, it can sometimes seem like narcissistic personality disorder, or NPD, is everywhere. But how typical is NPD, truly? Understanding the actual prevalence of narcissistic personality disorder can help us differentiate between typical self-centered behavior, such as occasional self-promotion or seeking attention, and a genuine personality disorder, clarifying why NPD stands out as a mental health condition. We'll explore the statistics, the criteria for diagnosing NPD, and why it may appear more common than it is. How prevalent is narcissistic personality disorder in the general population? Studies suggest that narcissistic personality disorder affects between 0.5% and 5% of the general population. However, estimates vary depending on the population sampled and the diagnostic criteria used. The differences in these statistics can be attributed to the challenges in diagnosing NPD, such as the need for a comprehensive assessment of the individual's behavior and the overlap of narcissistic traits with other personality traits and disorders. Key statistics on narcissistic personality disorder. Prevalence. A major study published in the Journal of Clinical Psychiatry estimates that around 1% of the population has NPD. Other studies that rely on broader definitions and criteria find narcissistic personality disorder prevalence rates closer to 5% in specific populations, such as clinical settings. While these percentages may seem small, they represent many people globally or within larger communities. Narcissistic personality disorder. Prevalence by gender and age. Research indicates that NPD may be more prevalent among certain groups, particularly when it comes to gender and age. Gender. Studies consistently show that NPD is more common in men than women. While the reasons for this are not fully understood, some researchers believe that cultural expectations and social conditioning around assertiveness, dominance, and self-promotion might contribute to a higher incidence of narcissistic traits among men. Age. NPD is generally diagnosed in adulthood, as personality patterns need time to develop and stabilize for a formal diagnosis. Additionally, narcissistic traits can sometimes decrease with age, as life experiences and maturity shape behavior and self-perception. However, in young adults and individuals in highly competitive or status-focused environments, narcissistic behaviors may be more visible or intense. Why NPD may appear more common than it is. While the diagnosed prevalence of narcissistic personality disorder remains relatively low, many people report encounters with narcissistic traits in their personal and professional lives. Here's why NPD may seem more widespread. Social media and self-promotion. Modern culture, especially in the age of social media, rewards self-promotion, image crafting, and attention-seeking behavior. These behaviors can mimic narcissistic traits, creating the impression that narcissism is more prevalent than it is. However, most of these behaviors do not meet the clinical threshold for NPD. High-visibility professions. Narcissistic traits can be advantageous in specific fields, such as entertainment, politics, and business, where confidence, self-promotion, and ambition are rewarded. As a result, we may encounter more people with narcissistic tendencies in these settings, leading to a perception that NPD is more common. Everyday narcissistic traits. Many people exhibit narcissistic traits at times, especially in response to stress, competition, or social comparison. However, these behaviors don't necessarily indicate a personality disorder. True NPD involves persistent patterns that impact multiple areas of life and relationships. Diagnosing NPD. Why it's less common than it appears. Diagnosing NPD is complex. Not all narcissistic behaviors qualify as a personality disorder, and true NPD involves more than surface-level traits. Here's why formal diagnoses of NPD are relatively rare. Severity and consistency. NPD is diagnosed based on consistent, pervasive patterns of behavior that interfere with daily life and relationships. These patterns can include a lack of empathy, a constant need for admiration, and a sense of entitlement. People with occasional narcissistic behaviors don't meet the criteria for NPD, as their traits may not be severe or stable enough. Clinical settings. NPD is more commonly diagnosed in clinical settings, such as therapy or psychiatric evaluations, where people seek help for relationship difficulties, workplace challenges, or other issues. Those who don't seek help may go undiagnosed, meaning the actual narcissistic personality disorder prevalence may differ from reported statistics. Social stigma. People with NPD may avoid seeking mental health support due to the stigma around personality disorders and mental health in general. As a result, many individuals with NPD may go undiagnosed, living with the condition without formal recognition or treatment. Why understanding narcissistic personality disorder? Prevalence matters. Recognizing that NPD is relatively uncommon helps reduce the overuse of the term narcissist. It clarifies when someone's behavior might reflect a diagnosable condition versus typical self-centered behavior. Awareness of narcissistic personality disorder's actual prevalence can also aid in encouraging empathy. Understanding that NPD is a mental health condition can foster a deep sense of empathy for individuals who struggle with the disorder, even if their behaviors are challenging. Setting boundaries with confidence. Knowing that NPD is a specific condition can empower you to respond thoughtfully to narcissistic traits, understanding when to set boundaries and when professional help may be needed. Recognizing the difference between traits and disorder. Awareness of the difference between NPD and narcissistic traits in everyday life reduces the risk of mislabeling people and helps focus support on those genuinely affected by the disorder. Seeing NPD in context. While it may seem like selfish behaviors are all around us, true narcissistic personality disorder is relatively rare. Understanding this can help us approach the topic with empathy, reduce misconceptions, and recognize when someone's behaviors reflect a genuine mental health condition rather than common personality traits. The information provided in this article is for informational purposes only and is not a substitute for professional advice. We are not licensed clinicians, mental health professionals, lawyers, or legal advisors. For any concerns regarding mental health or personal situations, please seek advice from a qualified professional. For more details, please read our full disclaimer.